If you're over 60 and worried about your male vascular function, this video can change your life. I'm going to reveal 5 specific exercises that are far more effective than just walking to keep your intimate health functioning perfectly. Before I continue, let me introduce myself. I'm Dr. Jane, a urologist with over 10 years of experience specialized in men's health. During this decade, I've treated thousands of men over 60 who face challenges with intimate vascular function. And I can tell you with certainty, most of these problems can be prevented or significantly improved with the right exercises. My mission on this channel is to bring quality medical information based on science, without taboos and without judgment. Look, let's be direct here. Erectile dysfunction isn't a matter of shame. It's a medical issue that affects over 50% of men over 60. And in most cases, the cause is purely physical, blood circulation problems. The good news? Circulation can be improved with specific exercises. If you want to keep your intimate life active and healthy, prevent vascular problems, and have better quality of life in all aspects, hit that like button now and subscribe to the channel. We're going to talk about real health, science-based, and straight to the point. First, let me explain the science behind this. Healthy vascular function for intimacy depends on 3 main factors: adequate blood flow, flexible and healthy blood vessels, and properly functioning nerves. As you age, there's naturally some deterioration in these systems. But, and this is crucial, specific exercises can slow down or even reverse these changes. Here's what happens in the body. Erectile function depends on blood flowing quickly and in large volume to specific tissues. This requires clean arteries, without plaque, with healthy endothelium, which is the inner lining of blood vessels. When you do the right exercises, you improve endothelial health, increase nitric oxide production, which relaxes blood vessels, strengthen the heart to pump blood more efficiently, and improve nerve sensitivity in the pelvic region. Studies show that men who practice specific exercises for vascular health are up to 60% less likely to develop erectile dysfunction compared to sedentary men. 60%. That's more effective than many medications and without side effects. Now, why isn't walking alone enough? Walking is excellent for general cardiovascular health, but for specific vascular function in the intimate region, you need exercises that work the cardiovascular system more intensely, specifically improve pelvic blood flow, strengthen the pelvic floor muscles that support function, and increase nitric oxide production more dramatically. Think of it this way: walking is like taking a general vitamin. Good, but not specific. The exercises I'm going to show you are like targeted supplements that attack exactly the problem you want to solve. Now let's get to the 5 exercises that every man over 60 should be doing if he wants to maintain healthy, intimate vascular function. Pay attention because I'm going to explain the correct technique, ideal repetitions, and the science behind each one. Exercise number 1, modified jump squat or explosive squat. This is the most powerful exercise that exists for improving male vascular function. Why? Because it forces the heart to pump blood quickly to the legs and pelvic region, creating an intense vascular demand that, over time, improves overall circulatory capacity. Here's how to do it safely for men over 60. Stand with feet shoulder-width apart, near a wall or sturdy chair for support if needed. Lower into a controlled squat until your thighs are close to parallel to the floor. You don't need to go very deep. Now, instead of rising slowly, rise with force and speed, lifting your heels slightly off the floor at the top of the movement. You don't need to jump completely, just an explosive rise is enough. If you have joint problems or balance issues, just do the quick rise without lifting your feet off the floor. The important thing is the explosive force, not necessarily the jump. Do 8 to 10 repetitions, rest 2 minutes, and do 2 more sets. Practice this 3 times a week, Why does this work so well? The explosive movement creates a sudden demand for oxygenated blood. Your heart needs to respond by pumping vigorously. Blood vessels need to dilate quickly. This trains the entire cardiovascular system to respond better when you need it, including during intimacy, which also requires rapid, intense blood flow to the pelvic region. Exercise number 2, plank with alternating leg raise. This exercise is fantastic because it combines core strengthening, cardiovascular work, and specific activation of pelvic floor muscles. Here's how to do it. Get into a plank position on your forearms, elbows under shoulders, body in a straight line from heels to head. If this is too difficult, you can do the plank on your knees. Keep your abdomen contracted and don't let your hips drop. Now, keeping your body stable, lift one leg about 6 inches off the floor, hold for 2 seconds, lower it, and lift the other leg. Continue alternating legs for 30 seconds. Rest 30 seconds. That's 1 set. Do 3 sets. As you get stronger, increase to 45 seconds, then 1 minute. Practice this 4 times a week. Why is this so effective for vascular function? The plank position requires your heart to work against gravity to maintain blood flow. This strengthens cardiovascular capacity. Raising the legs creates extra blood demand to the pelvic region and legs, and the need to stabilize the core deeply activates the pelvic floor muscles, which are essential for erectile function. They literally help keep blood inside the tissues during intimate activity. Exercise number 3, interval sprint or fast running in intervals. This is probably the most scientifically backed exercise for improving vascular function and nitric oxide production. But I'm going to show you how to do it safely after 60. Here's the method. You don't need to run at maximum speed. Find a pace that's fast for you but sustainable for 20 to 30 seconds. Start with a 5-minute warm-up of light walking. Then accelerate to your fast pace for 20 seconds. Then return to light walking for 90 seconds. That's 1 interval. Start with just 5 intervals if you're a beginner. Gradually, over weeks, increase to 8, then 10 intervals. Finish with 5 minutes of light walking to cool down. Do this 2 to 3 times a week, never on consecutive days. If you have joint problems, you can do this on a stationary bike or elliptical. The principle is the same. Short periods of intense effort alternating with recovery. Why is this transformative? High-intensity intervals force your blood vessels to dilate and contract quickly. This improves vascular elasticity. They also dramatically increase nitric oxide production, which is the chemical compound that relaxes blood vessels and allows the flow needed for erectile function. Studies show that men who do interval training have significantly higher nitric oxide levels than men who just walk at a steady pace. Exercise number 4, advanced male Kegel with resistance. You already know the basic Kegel, but I'm going to teach you an advanced version that really makes a difference for erectile function. First, identify the correct muscles, those you would use to stop the flow of urine. But here's the difference. We're going to add resistance and variations. Sit comfortably or lie on your back. Place a small rolled towel between your thighs, near your knees. Now simultaneously, contract the pelvic floor muscles, pulling upward, and squeeze the towel with your thighs. This combination activates more muscle fibers. Hold the maximum contraction for 10 seconds, breathing normally. Relax completely for 10 seconds. That's 1 repetition. Do 10 repetitions, rest 2 minutes, and do 2 more sets. But here's the secret. Do this 3 times a day, morning, afternoon, and evening. Frequency is absolutely crucial. Why is the version with resistance superior? The pelvic floor muscles, especially the bulbospongiosus muscle, play a direct role in erectile function. They help compress the veins that drain blood, keeping it inside the tissues during intimate activity. Weak muscles mean blood escaping prematurely. Strong muscles mean better ability to maintain rigidity. Adding the towel as resistance makes the exercise much more effective than traditional Kegels. Exercise number 5, bridge with prolonged isometric hold. This exercise is exceptional because it combines pelvic floor strengthening, improved pelvic circulation, and lower back strengthening. Here's how to do it. Lie on your back with knees bent and feet flat on the floor. Place your arms at your sides. Lift your hips off the floor until you form a straight line from shoulders to knees. At the top, strongly contract your glutes and pelvic floor muscles. Here's the difference. Instead of going up and down repeatedly, you're going to hold this elevated position. Hold for 30 seconds in the first week, focusing on maintaining the contraction of the pelvic muscles. Breathe normally, don't hold your breath. Lower, rest 30 seconds, and repeat. Do 3 repetitions of 30 seconds in the first week. In the second week, increase to 40 seconds. In the third week, 45 seconds. The goal is to eventually hold for a full minute. Do this 4 times a week. Why does the prolonged time matter? The prolonged isometric contraction creates a continuous demand for oxygenated blood to the working muscles. When you finally relax and lower, there's a rebound effect where blood flows intensely back to the pelvic region. This creates a pumping effect that improves local circulation. Additionally, the elevated hip position facilitates venous return, draining stagnant blood from the pelvis and bringing fresh blood when you relax. Now let me give you the complete implementation plan. Don't start everything at once, especially if you're sedentary. I'm going to give you a safe and effective progression. Week 1 and 2, start only with the advanced Kegel 3 times a day and the isometric bridge 3 times a week. These are the safest and most fundamental exercises. Week 3 and 4, add the explosive squat twice a week. Continue with previous exercises. Week 5 and 6, add the plank with leg raise 3 times a week. Maintain all previous exercises. Week 7 onward, add the interval sprint twice a week. Now you're on the complete program. Maintain this routine for continuous results. Here's your ideal weekly routine once you've fully progressed. Monday and Thursday, explosive squat, plank with leg raise, isometric bridge, Kegel 3 times a day. Tuesday and Saturday, interval sprint, Kegel 3 times a day. Wednesday and Sunday, only isometric bridge and Kegel 3 times a day. Friday, active rest, light stretching or easy walk. Every day, Kegel 3 times a day without exception. Now, crucial tips to maximize your results. Tip number 1, absolute consistency is key. Results in vascular function take time. You need at least 6 to 8 weeks of consistent practice before seeing significant improvements. Don't give up in the first few weeks. Tip number 2, combine exercises with vasoactive eating. Some foods specifically improve vascular health. Beets that increase nitric oxide, walnuts and almonds rich in L-arginine, berries with antioxidants, dark chocolate with flavonoids, garlic that improves circulation, fatty fish with omega-3. Include these foods daily. Tip number 3, avoid vascular enemies. Smoking is the worst. It destroys blood vessels. Excess alcohol harms function. Ultra-processed foods cause vascular inflammation. Excess sugar damages the endothelium. If you're serious about improving your function, eliminate or drastically reduce these factors. Tip number 4, manage stress. Chronic stress elevates cortisol, which constricts blood vessels and reduces testosterone. Practice relaxation techniques, meditation, or find hobbies that calm you. The impact of stress on vascular function is huge and often underestimated. Tip number 5, sleep adequately. During deep sleep, you have multiple nocturnal erections that are essential for maintaining tissue health. They bring oxygenated blood and nutrients. If you don't sleep well, you lose this natural maintenance process. Aim for 7 to 8 hours of quality sleep. Tip number 6, maintain a healthy weight. Excess body fat, especially abdominal, is strongly correlated with erectile dysfunction. Visceral fat produces inflammatory substances and reduces testosterone. Losing weight, if necessary, can, by itself, dramatically improve function. Tip number 7. Consider strategic supplementation after consulting a doctor. L-citrulline, that converts to L-arginine and increases nitric oxide, vitamin D if you're deficient, zinc for testosterone production, and ginkgo biloba for circulation. But always consult a professional before supplementing. Now let's talk about what you can expect in terms of results timeline. This is important for maintaining realistic expectations. In the first 2 weeks, you probably won't notice changes in erectile function, but you'll start feeling more energized and the pelvic muscles getting stronger. In weeks 3 to 6, some men start noticing subtle improvements, maybe more frequent morning erections, which are a sign of good vascular health, maybe slightly better quality during intimacy. Changes tend to be gradual. In weeks 7 to 12, most men experience more obvious improvements, better quality, greater confidence, faster recovery. This is the period when vascular benefits really start to manifest functionally. After 3 to 6 months of consistent practice, results generally stabilize at the new health level. Studies show that men who maintain specific exercises for 6 months or more have lasting improvements that persist as long as they continue the routine. But attention, these exercises aren't magic. If you have erectile dysfunction caused by advanced diabetes, severe vascular disease, significant neurological damage, or very low testosterone levels, you'll need additional medical treatment. Exercises can help, but don't replace appropriate treatment. Now, warning signs that indicate you need to see a doctor immediately. If you have sudden and complete loss of function that didn't exist before, pain during intimate activity, abnormal curvature that recently appeared, cardiovascular symptoms like chest pain during exercise, or inability to get any response even in the morning when hormone levels are highest, you need urgent medical evaluation. Sudden loss of function can be an early sign of cardiovascular disease. Remember, the blood vessels involved in erectile function are smaller than coronary arteries. Problems there can appear first as erectile dysfunction before manifesting as heart disease. It's an early warning that shouldn't be ignored. Let me also address some frequently asked questions. Question number 1. Do these exercises work if I already take medication like sildenafil citrate? Yes. In fact, combining exercises with medication often allows you to use smaller doses or need the medication less frequently. But always discuss with your doctor before changing any medication. Question number 2. How long do I need to do these exercises? To get and maintain results, you need to incorporate this as a permanent part of your lifestyle. Just like you need to keep brushing your teeth to keep them healthy, you need to keep exercising to maintain vascular health. Question number 3. Can I do these exercises if I have heart disease? That depends on the severity. You absolutely need to consult your cardiologist before starting any exercise program, especially high-intensity intervals. Some men with controlled heart disease can do modified versions, but this should be medically supervised. Question number 4. What if I've had prostate surgery? After prostate surgery, especially radical prostatectomy, pelvic floor exercises are absolutely essential for recovery, but you should work with a physical therapist specialized in pelvic health to ensure you're doing them correctly. Question number 5. Is there a maximum age to start? No. Men in their 70s, 80s, even 90s can benefit from these exercises. You may need modifications based on your individual capabilities, but it's never too late to improve your vascular health. Let's recap the main points. Erectile dysfunction after 60 is primarily a blood circulation problem that can be improved with specific exercises. The 5 essential exercises are explosive squat, plank with leg raise, interval sprint, advanced Kegel with resistance, and prolonged isometric bridge. Start gradually over 6 to 7 weeks to reach the complete program. Combine exercises with vasoactive eating, elimination of harmful factors, stress management, and adequate sleep. Significant results usually appear after 6 to 12 weeks of consistent practice. Seek medical evaluation if you have severe or sudden symptoms. These 5 exercises can literally transform your intimate life and your confidence. Imagine having the security of knowing your body will respond when you need it. Imagine the improvement in the quality of your relationships and your self-esteem. All this is possible with consistent dedication to these scientific exercises. If this video was valuable to you, hit that like button and discreetly share it with other men who might need it. Many men suffer in silence because they're ashamed to seek information. You can help someone by sharing this knowledge respectfully. Save this video to consult the techniques when you need them. Subscribe to the channel and turn on notifications because I'll continue bringing transformative medical information about men's health, always based on solid science. And comment below, I'm going to take care of my vascular health to commit. Remember, there's no shame in taking care of your health. It's a sign of maturity and self-care. In the next video, I'm going to talk about specific foods that naturally increase testosterone production after 60. You won't want to miss it. Your quality of life, your confidence, and your health are in your hands. These 5 exercises are scientifically proven tools that put you in control. Start today. A hug and see you next time.